If you're a newlywed, if you are engaged, about to get married, please pay attention to what I'm about to say. Why miscarriages are common mostly with first pregnancy. Now, note that every woman's experience with miscarriage is unique, is different. The cause of Sister A's miscarriage differs from your own. So, when it comes to counsel, advice, treatment, and care, it differs based on individual. An approach is usually not the same because the underlying cause of the miscarriage is likely not to be the same. So with that in mind, a possible cause of miscarriage with first pregnancy could be that there's an abnormality with the chromosomes, abnormal development of the embryo, which could lead to a miscarriage. Another possible cause of miscarriage with first pregnancy could mean that there's imbalance in your hormone. Progesterone is the hormone that helps to maintain pregnancy. Now, when the level of progesterone in your system is low, there's insufficient hormone to maintain pregnancy, and then an abortion is most likely to occur. And there's uterine abnormalities. People who are born with abnormalities with their womb, with their uterus. Maybe the uterus has an abnormal shape, bicornate uterus. There are people who have two uterus, and even the presence of a fibroid, an abnormal growth within the uterus, can cause a miscarriage. People who consume alcohol, people who smoke, people who engage in stressful activity, occupation, this increases the risk of a miscarriage, especially with your first pregnancy. Physical stress, emotional stress, they can all increase the risk of a miscarriage with your first pregnancy. So medical conditions can also be an underlying factor. Medical conditions like uncontrolled diabetes mellitus, people who have issues with thyroid diseases, resource incompatibility. I'm going to come back to this point, resource incompatibility. At this point now, people begin to look for who to blame. This one is the cause of my miscarriages. This one killed my baby. This one did that. This could be one of the reasons why women keep losing their pregnancies. Nobody they do you. Now ignorance they do you. Infections like rubella, urinary tract infection, it can cause a miscarriage in the first trimester of pregnancy. Age also could be a factor. It is believed that women who become pregnant above the age of 35 stand the risk of having a miscarriage in their first trimester of pregnancy. If you are an intending bride, a newlywed, fortify your diet. Eat balanced diet. Stay hydrated. Rest. Engage in mild exercise. Miscarriage is common. It does not mean that you will not have healthy pregnancies in the future. After a miscarriage, seek for emotional support. It is very natural to grieve, but seek for emotional support from close family members, from close friends. If possible, you can seek the help of a counselor. You can ask your care provider the cause of the miscarriage so that you can be guided for subsequent pregnancies. Seeking emotional support will help you navigate through this phase. Take time to heal. Take time to heal. You rest, you stay hydrated, you eat well balanced diet. Fortify your immune system. Nourish your body. Forget all these things that they'll say, take this one, it will flush it out completely, you'll be fine, you'll be okay, take this concoction, take that concoction. No. You need to be reviewed and checked by a trained professional to now ascertain if there's any underlying complication that will affect subsequent pregnancies. Maintain a healthy lifestyle. Avoid alcohol consumption. Don't smoke. Rest well. Embrace self-care. Don't mourn yourself forever. I know it is natural to begin to blame yourself for being the reason why you had a miscarriage. Don't blame yourself forever. Engage in self-care. Those activities you do that gives you peace of mind, that gives you joy. You want to go on a vacation, you want to rest, you want to watch a movie. Ensure that you are healed completely, body, soul, and spirit, before you embark on this journey again. I await your testimony. Always remember that I care. See you in my next video. Bye.